Hey everybody, we're back with Dr. David Middaugh, and we're going to be talking a little bit more about the squat. And a lot of times, David, we see people when they squat a really big tilt at the hips. So, for example, somebody's squatting and they're moving and they're in a good position. As soon as they get to a limited point or a limitation point, you know, this starts to happen, and the hips don't drop, the shoulders keep coming down. What's happening, and how do we fix it?
Yeah,
or address it at least?
There's too many things that are happening. It's different. Everybody, you can have both at the same time, or having one individually. It could be weak abs and weak glutes.
Okay.
And so which forces them to have over dominant back muscles, and that's why they're bending that way, because they're putting their backs in a position where it can take more weight and then get out of there with their back. But the lower you sink your hips, it's more glutes.
Okay.
And so what needs to happen is we need to really strengthen those abdominals and the glutes. Of course, try to address the form on the squat, make sure that you're more upright, make sure you're trying to sink down a little bit lower. But you likely need to do some accessory work on the side, some good warm up of the abs and glutes. And then on off days, I would definitely do some ab work and some glute work if possible.
Okay.
And so just let me show you with this stick here a couple of common things. Could you put this stick on your back, Mark? And this is something you can do to check yourself. It's just a PVC pipe. So Mark's going to put this up against his tailbone area, kind of right between the butt cheeks there, and then this is going to be in the middle of the back. You should have a small curve right here in your back that's normal. It shouldn't be too big. Like if I slide my hand under here, the stick should be touching my hand and touching his back. I shouldn't be able to wiggle around much here. So that's too much right there, and that's just right there. And then ideally your head should touch the stick as well. So now as Mark squats down, all these contact points should stay the same, and this gap shouldn't increase. And see that he's increased it right there? That's too much back extension right there. So that's a sign that the abs are a little weak. So now let's try to correct for that. Just try to keep your back flat as you squat, flat against the stick, but upright. Yeah, that's better right there, definitely better. My hand doesn't wiggle as much. And you can see his depth there is a little bit better as well. Try to sink your hips even lower on the next one. Yeah, there you go. And it's okay if you smash the stick here. That's going to naturally happen in the lumbar spine. It'll kind of curve out. Butt wink is what they talk about happening there. That's okay. So we want that stick to stay fairly flat against the spine, not much wiggle room down here. If you find that you're extending too much, then we got to work on the abs. So something, you can take the stick down, Mark. Something you can do to strengthen the abs, a great isometric exercise. Again, I like the isometrics because it just gives a chance for all the fibers inside of a muscle to fire and start to contribute to the force. So can I have you lay down here? And we got a treatment table here, of course. You can do this on the floor or wherever you like. And you just lie flat all the way here. Stretch out your hands towards your feet. Now, flatten your spine here, so push down, and that will kick in those lower abs. Make sure that your abs kind of turn on. And then start to bring up your head, bring the chin to your chest, and then curl up. Keep those legs down though, if you're wanting to come up. So come back down. I want this to be an isometric contraction.
Good.
It means you're gonna hold. You're gonna hold at the weakest point of the motion where you start to kind of shake on the way up.
Yep.
Hold it there. So try it again. Hold right there, hold right there. See how Mark's kind of hanging out there and shaking, and keep those legs pressed down. That might turn on your glutes, but we want that because if your legs are coming up, you're kicking in your hip flexors, which help contribute to the problem here. Right. Because the hip flexors, the psoas muscle specifically, it attaches to the front of the spine and it makes your back curve in a bad way. So then you do that, you hold for about 10 seconds, this is what I usually have people do. Just hold right there where you're most shaky, keep the legs down, and have people do it for about 10 reps. And this will get your abs burning. It'll get your, especially your lower abs, the more you flatten out your back, it'll get the lower abs right below your belly button to really burn, and that's a good thing. It gives you good stability there. So you want to be doing that with pretty much all ab exercises, pushing your back flat, sit-ups, crunches, toes to bar. All those exercises are great to do that with.
Right.
Now let's say you want to work on your glutes because that's something that's a problem. Usually when people are doing that bad squat where their upper body's coming down and their butt's relatively high, and you want to get to this better, their glutes are so weak that they just can't control that lower motion. So something you want to do is hold on to something fairly stable. This should be enough for me here, and it'll offload you a little bit so that you're able to get down in better form. And then again, hold it right there. So you're holding an isometric
I want to
contraction.
go all the way down, or are you just going a little bit past parallel to where you feel it turn on?
So if I'm just squatting down, like I'm gonna squat down to do something on the floor, that's where I get to. If I hold here, it'll allow me to get more upright. But then I want to come up a little bit and get those muscles to turn on. Now one more thing here. I feel my quads burning here, which is not a good thing. I need to be glute dominant on my squats, not quad dominant. So if I push my knees out a little bit, now my glutes are turned on. Now you ideally want to hold on to something sturdy. This isn't the sturdiest, maybe like a squat rack, a counter or something like that.
Table, couch.
Yeah, and do this for 10 seconds. 10 reps is an excellent warm up on a squat day. So once you give that a shot, Mark, you're just so that you can see your form improve. So first, squat without holding on. You can stand right there and do it. Okay. Yeah, and just hold it right there. Notice the angle of the spine right here. All right, now hold on to the table on the next one, and just lightly hold on. You don't have to hold on for dear life. A lot straighter. You can dip his butt down lower, and then play with your knee position. The more out you are, the more the glutes turn on. Versus if you come inward a little bit, it'll activate the quads a little bit more, which is not a good thing. You don't want to have a quad dominant squat, because when you think about it, when you're coming up out of the squat, it's those butt muscles that need to get you up.
Yeah. Okay.
So you want those strong.
So what's happening to review is as somebody's squatting and their chest is coming forward, they're really hyperextending the back and trying to turn on and do most of the work with their back muscles.
Mm-hmm.
Correct? Instead of their glutes and their legs or their hammies.
Right.
Right. So they're trying to put their position to their body's the strongest position, because these are weak.
Right.
So that's a lot of times what happens. Not necessarily maybe every time, but a lot of times that's what happens.
Common,
So
yep.
we're working on strengthening our glutes, and we're working on strengthening our core,
Yeah.
which eventually should pick. Right. So when we squat, let's say it's a 5x5 day, or it's a heavy day, it's somewhere around 80%.
Mm-hmm.
What do? And we're not there yet. We can't get into a perfect position yet, and we're still finding ourselves kind of dipping forward. What do we do?
Back off on the weight. I would do higher reps and lower weight,
Okay.
so that you can get in a good position. Now, one more thing you might just look for and differentiate. This is a strength issue here that we're addressing.
Sure, yeah.
If it's a mobility issue, then we'd address it differently. But just so that you can know if you have a strength versus a mobility issue, all you gotta do is lie on your back and bring your knee to your chest. So go ahead and lie down here. If your thigh is within an inch of your chest, he does not have a hip flexion problem there. So there's
So if it's like here, right? And you're talking about thigh, this part of your thigh,
Yeah.
the
About the middle of your
highest
thigh?
portion of your thigh.
Yeah.
Your chest.
Yeah, if there's no more room to pull it into, you do not have a hip mobility problem. And I'm talking about the joint, or sometimes the soft tissues can be a little tight for some reason, various reasons. Then you have a mobility issue. But if that's not the case, like in Mark, he does not have a hip mobility issue. It's more of a strength issue that we need to address.
Okay.
So then you need to be doing the exercises like we talked about here. And truth be told, squats, the more you squat, the better your squat should get. You just gotta have a good idea of what good form should look like.
Yeah, it's just where you're putting your body mindful of your position.
Yeah,
Okay.
yeah. Don't feed into the problem if you're hinging over like that and you feel like your back muscles are burning a lot after you've done squats.
Yeah.
You've used your back muscles too much. You should feel like your glutes are pretty worn out, pretty fatigued and tired after you finish squats. Not your quads, not your back muscles.
Okay. Well, thanks, Dave.